this is the last time I will sit in this chair as chairman of the Assembly Health Committee. It has been, as I think about this day and the last voting session to come up, one does turn their mind to things they might say at moments like this. And the first thing, certainly go back to people who have chaired this committee during my time here, now 27 years ago. Charlotte Vanderwall from Bergen County as an example of my first chair here. We did a great job. And of course, the inimitable Loretta Weinberg, who was chair before this committee before me. I was fortunate enough to be her vice chair for some of that. And Joan Quigley, I see grandson out here, up there, who was vice chair of this committee. So I think about the two of them, and I think about the many colleagues with whom I've worked on this committee over the years. I think, on the Republican side, I think that we've spent and you, Mr. Ron, have spent probably the most time sitting as the loyal opposition. Yes, that's right. A couple of them. Absolutely right. And the number of people who have served with me on this committee, all of whom concerned, and rightly so, to advance the state of health of the citizens of New Jersey. It has certainly been an honor and a privilege to serve with so many thoughtful people working through the often very knotty issues that involve healthcare and healthcare policy. I certainly think of the many staff members who have worked with us on producing what I think has been a very fine work product over a couple of decades now, and certainly sitting here to my left here presently, but as I look out in the office I see former chiefs of staff, John Chebra and Justin Rodriguez, and I see Ben Graziano here as well, and my two aide-de-camps in terms of Brian Quigley and Kaylee McGuire, who have played such an important role in making us look good, first of all, but adding their insight and input on, again, as I say, some of these very knotty issues. I want to thank, too, the many advocates for legislation. The times where I remember about families coming forward, just as today, who've been touched by an issue that we've been able to address here, those larger issues on healthcare disparities, vaccine policy, policies as it relates to hospitals, and the practice of medicine in our patients. These are among the very important remits of this committee. And, as many of you know, I try always to base our actions here based on what we know, what's scientifically known, and try to push aside and not bring forward things that don't have that kind of substantiation, don't have a grounding in the medical evidence. Legislatures are not equipped to practice medicine. We set the tracings, we set the guidelines, but we provide a way for the healthcare system to work as well as it can for the people who need it. That's the patients, certainly, and for those who do who provide the care. And so I just want to say I'm grateful for the collegial work that this committee has enjoyed over many years. Going off to other things, as you all know, and a new chapter, and I look forward to that. But as ever, I remain grounded in principle in all the things that I do. And I just want to thank all of you here now and past who have been such an important part of my service. So.
Well, thank you, Chairman Conaway. As I'm departing as well, and other people have done my platitudes, now it's your turn. I've only sat on this committee, with you for a few years, but it's certainly one of the committees that I aspired to want to be on for the 19 years that I've been doing this. You certainly, well, it's a hard one to get on,
There's stations at the top.
It's, when you get a chairman who runs a committee as well as you do, you're authentic, you're thorough, you're very dynamic in all of those facets, and you show strong leadership. And so you take on the tough issues. You give people the time to be able to convey, their thoughts and what they want to be able to add to the scenario. And doesn't come naturally to some people, and it comes naturally to you. And what I wish for is that as you're going down to Congress, that you take this energy, this professionalism, and you exemplify, what New Jersey stands for, and New Jersey strong, right? And you continue to exemplify what New Jersey stands for down at the federal government. And I do wish you all the support you need to be able to do that. We'll always be here for you. I just feel that the State House is going to have a significant void with your departure. So thank you for all that you have done for the state of New Jersey.
Assemblyman Conaway, Chairman Conaway. I remember when I was elected in 2018, and I'm on the Health Committee, and I have to go back to one of our first committees. My first committee, it was in regards to mandating immunizations, and that was one of the craziest meetings for a new member to go to. But the way you handled it so well. You was cool, calm, collective, and left that meeting with ease. And I knew that I wanted to stay on this committee since that chaotic committee. And I knew that your guidance and your leadership have shown me over the past few years since I've been an assembly member how to conduct myself as a chairperson in my committee. So I know, like, you will be truly missed. So many members will miss you, but when it comes to myself, your guidance and your leadership has definitely helped me over the past several years. And when it comes to voting on certain pieces of legislation, oftentimes I look to you and say, well, if Conaway is not supporting it, I'm not going to support it. So just thank you so much for your leadership. Don't forget about the little people in the state of New Jersey when you leave us. So I applaud you, congratulate you, and just pick up your phone when we call you. The assembly members, we are still important with you. So I appreciate you and I love you, and may God continue to bless you and keep you covered and keep you safe. I love you. Take care.
Chairman, I also just wanted to say thank you. I remember that I got here in 2018 as well, so that was a great introduction to the Health Committee. But they don't really give you a guidebook when you get here as far as how to be a member of the Assembly. And so you look at those that are respected and those to emulate and to learn from. And there's a reason why you're one of the most respected members of this body. Your thoroughness, the way you lead this committee, you have made a real difference here. You've made a real difference to the lives for so many in the state of New Jersey. And you're so effective at passing very consequential legislation. So I'm sure Congress will be a much different experience. But I know you're going to take that. Yeah. But I know you're going to take that tenacity, and I know you're going to represent us so well. So I really just wanted to say it's been a true honor. Thank you, and congratulations to you. It's well-deserved, and we will certainly miss you here, but we know you're going to do a great job representing us in D.C. So thank you, sir.
Chairman Conaway, thank you for allowing me to serve on this committee over the years. Your leadership and guidance is second to none. I have to say one thing about you being the chairperson here: consistency. You always know the issues, and you always address them accordingly. But one thing I want to bring up, for as long as I've sat on the committee, Chairman Conaway has been consistently late for starting meetings. But it's been an honor and a privilege. We've got to be friends. You've been a mentor in a lot of different aspects of my time here, and I know that we'll be talking a lot since you will be representing one of the municipalities in your district, and you're always accessible, and that's the good thing about it. And you can talk freely and agree or disagree, but come at the end with the result of you understand better, I understand better as a committee member, and I'm grateful to the opportunity to serve with you. So good luck in a new chapter, and God bless, and be on time.
Chairman, well, to be fair, I mean, how many doctors that you know are on time? I think it might be part of our medical training. I don't know. But I'm going to be brief. Unfortunately, similar to our time together, which has been brief, but it's really been an honor to serve with you on this committee, and to it's been a crash course in how to combine medicine and policy and leadership. So, but I appreciate every moment, and grateful for your leadership, and looking forward to being in touch with you while you're in Washington to hopefully get some things done for us here in New Jersey at a bigger level. Thank you.
And, you know, we can contend, but we should always remember about gentleness and kindness. I think it's an important quality. I think it's often overlooked and shouldn't be, because it will allow us to get to the heart of the matters, the heart of decisions that need to be made. And that can be more effectively done if we treat each other with respect. And certainly one of my hallmarks, and it's not unique to me, but it's something that we're called upon to remember from time to time, and heated moments. I was remiss on a couple of comments with Mr. Diakono Rich here next to me, and I think back to David Price and Mike Fonke, who have you've had to deal with a lot of amendments over times that are made on the fly as we work through these issues. But the professionalism of our staff here at OLS. I've been around the country speaking, with fellow legislators, and I have to say, I don't think anybody does that background work administratively for bill making better anyplace else in the country than here in New Jersey. And it's really a testament to wise decision making years ago when the office was established, to both make us look good and make sure, on the one hand, but help us to work through some of the word craft, the language craft that ensures that these bills are understood and recognizable. Ideas have to be put into language, after all, at the end of the day, and language will be tested and will be reviewed, and it's important that it's right. And you and Rich and the others who have served on this committee, with whom I've had the privilege to work, have really done a fantastic job, and I'm grateful for that as well. Anybody else in the audience? No? We're out? Okay. Thank you, Herb. You're welcome.